Today's lecture will cover exposure systems. To improve consistency, the number of variables should be minimized. Technique systems should be used for all X-ray units, and it is best to measure with calipers for best practice. Fixed KVP systems were developed in 1943. They decrease patient dose, provide more information, increase consistency of IR exposure, lengthen exposure latitude, increase tube life, decrease time settings, and are easier to remember. These systems tend to use higher KVP settings, which provide lower contrast and increased scatter. KVP is fixed and mass is selected according to the volume, thickness, and density of the part. Variable KVP systems were developed in 1925. These systems permit incremental changes to adjust body part thickness and produce higher contrast and enhance visibility of detail, decrease tube life, decrease exposure latitude, and image quality is more pleasing to most facilities. With these systems, KVP is varied depending on volume, thickness, and density of the part, and mass remains consistent per part. Anatomically programmed radiography systems, also known as APR, are used in combination with automatic exposure control to select techniques based upon anatomical parts. This is set up by an application specialist and can be fine-tuned as needed. Phantoms are used to develop and fine-tune exposure charts. They select the optimal image to retrieve technique information from, and then perform clinical trials on patients only after phantom testing is properly completed. The maximum KVP that will produce images with appropriate contrast is known as the optimal KVP. This is used for fixed and variable KVP systems. It requires adequate penetration of the part and acceptable image contrast. For variable KVP development, the standard rule is 2 kVp per 1 centimeter of tissue. For smaller parts, such as extremities, there's a base of 30 kVp. For dense bone, spine, and shoulders, there is a base of 40 kVp. And for parts such as chest, abdomen, and pelvis, there is a baseline of 50 kVp. A plus or minus 10 change in KVP can be used to double or half density. This is based from the 15% rule. A limited variable KVP scale helps to reduce extreme variation by ensuring all contrast is acceptable to the radiologist, providing adequate penetration, and avoiding excess scatter. In summary, each facility has an established fixed and/or variable technique chart. Some departments have both due to multiple vendor technology or radiologists. Be sure to develop, maintain, and constantly fine-tune your own exposure logs throughout your clinical education and your career.